And it's Mornings with Sue and Andy. A new pill being tested by Pfizer sounds promising. It may have the ability to stop the coronavirus from replicating before patients get very sick. Dr. Raywat Deonandan joins us now to give us some background on how it works. Good morning to you, Dr. Deonandan.
Good morning.
Thank you for taking the time with us. I just want to clarify, this Pfizer pill that's in the works and being tested out, this is not a pill version of a vaccine. Is that right?
That is correct. What it is, it's a protease inhibitor. And what is that, you ask? Well, viruses work by entering your cell and hijacking the machinery of your cell to create more copies of itself. And one of the ways it does that is by, using the machinery, the factories in your cell to crank out proteins. So viruses have an enzyme called a protease that allows a couple of things. It allows them to get entrance to your cell, and it's like a scissors. It cuts out proteins to make new copies of itself. So this drug inhibits that enzyme. It's a protease inhibitor. We've used similar things in the past for, other diseases, other viruses, including HIV. So the idea is this kind of drug just stops the disease from replicating, so it prevents you from getting sicker.
So it's not going to stop people from getting the virus and getting sick, but hopefully, what happens down the road once you do get the virus, that might help.
It might actually arrest replication before disease actually takes place. So once you've been exposed, once the virus is in your cell, it may actually stop it from actually becoming technically a disease.
Oh, okay.
So it's unclear. It depends entirely on how efficacious it turns out to be.
We have learned much more about vaccines and actually drugs in the pharmaceutical industry, I think, as a society over the past year than we ever would have thought. So we do know that there's processes. And when you talk about a trial on a pill like this, how long would something like this take? Are we talking weeks, months?
Right. So this particular drug is entering its phase 1 trial, which is the very beginning. Before the phase 1, you've got the lab test, you've got the animal models. And based upon the lab test, looking at how it works in the test tube, it seems to prevent replication of the virus. That doesn't tell us a lot because the majority of drugs that are successful in the lab don't go on to be successful in people. So the phase 1 trial simply tests whether or not people are going to get sick from it. So it's given to healthy people who have not been infected with COVID, to see what the tolerable dosage would be. Now, that'll take a couple of weeks to figure out. Phase 2 then determines how efficacious it is, and phase 3 is the big one, and that'll tell us exactly how well it works in the real world. So that would probably be by the end of the year. I would anticipate phase 3 numbers will come back. But remember, the majority of drugs fail at each of these steps, so it's only a tiny minority that make it to the end.
Doctor, let's just say everything goes beautifully, perfectly as planned. We do get this drug approved. It seems to do what it's supposed to do. So would you consider it sort of an easy to use, just I take one pill and I'm good to go kind of treatment?
It might be that, yeah, it might be. We've had other protease inhibitors, in the market for a while, and they're pretty safe. So the kinds of, side effects you get are gastrointestinal events, diarrhea, nausea, vomiting. And some people get some metabolic complications, something called dyslipidemia, which elevated cholesterol. So if that's the case, you just take a cholesterol drug. So we obviously, if it makes it to market and people start taking it, it has to be monitored by a doctor so it doesn't shorten your path to diabetes. So nothing is without a cost here. But yeah, probably, maybe a course of pills over the course of a week or so, like an antibiotic. But if it gets there, that'd be fantastic. That means we have this thing beaten.
Dr. Deonandan, I'm wondering, because we have so many vaccines, I know in the province of Alberta here, you're from the University of Ottawa, from in Alberta, we have about 500,000 people haven't been vaccinated so far. So it's almost like 1 in 8 or 1 in 9 people. So the vaccine rollout continues. If it takes months for this pill that minimizes the effects, what could you see the use being if we have herd immunity or we've been vaccinated? Would this still be used if you've had a vaccination to minimize any effects, or would this be purely for people who had not had the shot?
No, because vaccination isn't perfect, and vaccination will wane. The immune effects of the vaccination will wane, kind of like the flu vaccine, right? Mm-hmm. So we're anticipating COVID will become endemic. It'll be with us for many, many years, which means you need a booster shot every couple of years, possibly. This may take that requirement off the table if we can make it so unscary that you don't need to take a vaccine. So that's an ideal scenario. I anticipate that our future will see a combination of vaccination and treatments so that this will not become a newsworthy disease anymore.
If it is something that needs to be prescribed, how do you see it? If I'm just starting to feel some symptoms, perhaps I go to my doctor and they prescribe this pill just like any other medication might be prescribed?
Exactly. They may give you a COVID test to confirm the diagnosis, which is the right thing to do because you don't want to give you a drug that you don't need. And also, it may be useful against future coronavirus variations, like MERS or traditional SARS. The variants, it's unclear because the protease will be different in every new variant. That's something they're going to test as well. But this is, again, an important tool if it pans out. And by the way, there are other competitor drugs going through similar phases. We just happen to know about this one because they released the press release.
Good stuff. Thank you for breaking it down for us, Doctor. We appreciate it.
Thank you very much.